Hey guys, welcome back to my channel. It's Simone from Simone's World, and I'm here to let you know what's going on in my life. So hopefully what I'm about to tell you guys will help someone else. I'm going to be having a breast reduction. I'm very excited. I don't even have the words to just get across how happy I am. And I wanted to go through the process. The reason being is when I was going through the process, a lot of the videos I found are from people from the States or the UK. And the process is a little bit different here in Canada. It's actually pretty simple and it's very easy. So I'm just going to jump into it. I'm going to try to make it short. I do ramble a lot, so I'm going to try to cut it down. So let's get started. So when you want to have a breast reduction done, there are a few steps you have to go through. The first step is to go to your family doctor or any normal physician, and you have to get a referral from them to see a plastic surgeon. So I went to my family doctor. She referred me to a plastic surgeon. I told her what I wanted, and she referred me to Dr. Zale Krajden. Now, once you get that referral, you then have to visit the plastic surgeon's office. And Dr. Zale Krajden, he basically looked at my breasts, he assessed me, and he advised that I'm a perfect candidate for a breast reduction surgery. Now, that is just one of the many steps that needs to happen. So once your doctor, your plastic surgeon recommends you, or basically says you're a good candidate, he or she will then put your application into OHIP. OHIP will pay for the reduction portion of your breast reduction. Now, the reason why I say that portion is because Dr. Zale Krajden did advise me that if I wanted a lift, I would have to pay a cosmetic fee for that, because OHIP is only going to cover for the reduction, as that is what is all that they cover. So if I wanted the lift, I would have to pay for it out of pocket. Also, he advised me that I do not get to choose the size of boobs that I go down to. The doctor will, based on your height, your weight, and just basically criteria that OHIP and everyone has set, they will choose the size of boobs you go down to. So that was a bit disheartening for me, because I personally wanted to be as small as possible. He said I'd probably end up being a very bigger D or a small double D. So that's what I'm going to be going down to. And he said he'll be taking off about 5 to 7 pounds off of my breast. And I would most likely be getting an anchor stitch. So basically, he'll go around the nipple, he'll go down, and then under. So that's what he advised me that he would do. Also, when you pay for the cosmetic fee of the breast lift, you also are paying for liposuction. The two are one and the same. You cannot have lipo without getting the breast lift, and you cannot have the breast lift without getting lipo. I was kind of iffy about that. I didn't want lipo because I didn't think I needed it. But he informed me the lipo is just for the underarm portion of your boob, like the side boob. And also for symmetry. When he's basically done taking out the skin and stitching you in, he'll go into some lipo to just make sure that the boobs are symmetrical and that everything is even on both sides. So that is why you need the liposuction. For me, that was my biggest concern, just because I didn't know if I really wanted it, but they're one and the same. If you're getting the breast lift, I guess if you don't want the lipo, you could say you don't want it, but you're still going to be paying for the lipo. So I said, sure, I'll get the lipo. I'm already paying for it. Why not? So that's what happens at the doctor. He just runs through a consultation with you, and then they'll put your application into OHIP with his approval, saying he thinks that I'm a good candidate for a breast reduction. Now, OHIP will take 1 to 3 months to get back to you. And once they get back to you, you'll then have to go on the doctor's waiting list. Now, my doctor had a waiting list of 6 months. So after OHIP approved me, which took them about a month and a half to approve me, I then had to go on my doctor's wait list. Now, every doctor's office is different. They do have like an emergency list. Like if someone cancels, you can get that appointment. But usually you only have 4 to 5 business days to get everything completed before your surgery. And that was a bit too short. They did call me for one, but unfortunately I wasn't able to accommodate that time. So I had to wait till the 6 months were up, which was in December. And they booked me in for January 25th. Now, once you've gone through that whole process and you've got your appointment date for your surgery, you have a few leftover things you have to do. You have to have one last consultation with your doctor. So you go in and see your surgeon, and on that day you'll meet your nurse, your aftercare nurse. So basically after your surgery's done, you will see the doctor, but the person you'll be seeing more is going to be your nurse. Your nurse will be taking out your drains, assessing your scars, taking out any any other stitches that need to come out. Usually there's only one stitch that's not dissolvable, and it's the one that they use to stitch your drain in with, and they'll usually pull that out when they pull your drain out. So I met with that nurse, and she basically explained everything she'd be doing and like who she would be for me, and she was very nice and very informative. You'll meet with the doctor one last time, basically to go over everything again, go over your boobs and just like how much you'll be taking off. He'll talk about the stitch that he's going to be doing, and then if you have any questions, you can go ahead and ask him then. So once you're done with that, you'll go out to the receptionist, and she'll give you a bunch of pamphlets that you'll need, and you'll need to do two other things. You'll need to schedule a pre-op appointment with your family doctor, and then you'll need to be speaking to the hospital that you'll be having your surgery at. So and she'll give you a bunch of pamphlets. We'll give you a bunch of information about the procedure and things you have to do beforehand. She'll also give you a paper, well, my doctor. Now this might not happen at another doctor's office, but my doctor doesn't have surgery bras. Now I know a lot of people, they purchase a surgery bra from their surgeon that they use for after surgery. My surgeon does not have one, so she gave me a paper with this bra on it. That's the name of it, and she basically told me to go to the store and purchase this, as this would be my surgery bra. They don't have surgery bras. So basically this is the name of the bra. It's called the Full Freedom Comfort Front Hook Closure Bra. This is an extension bra, so it's this is supposed to stretch to fit a B, C, D, and a double D, which is what the biggest size I would be going down to. So it can be found at Giant Tiger and I think Walmart. I did see them at Giant Tiger, but they only had the white and the beige, and the receptionist told me to get black because you will have a bit of blood and stuff and gunk from being in this bra when you leave surgery. So she said to get two, and preferably black. So I ended up having to get this on Amazon because Giant Tiger only had beige and white. So this is what it looks like. This is the bra here. It's black. This is extremely small compared to like my boobs now, but supposedly my boobs will fit in here. It has a lot of stretch, and it is a front hook. It has about, I think, five hooks in the front that you just hook in here, and it closes up. So this is how big it is. Now I'm normally a 36 or a 38 around here, and because I thought I would be swollen, I got two different sizes. I got a 40 and a 38. So those are the two sizes in the bra that I got. The 40 I'll use for right after surgery, because obviously I'll be like the most swollen. And then after I'm cleared to shower and stuff, I will change into this one while my other one's being washed. What else? On the pamphlet, she'll give you a bunch of tips. So you will need a body pillow or a bunch of pillows. So this is the body pillow that I have. I got mine from Costco, and it was $10. Now, you don't really need a body pillow. You could buy a bunch of other small pillows and use them as a pillow fort to stack up around yourself. The reason being is because they don't want you to roll over on your boobs if you are a person that sleeps on your stomach or your side, because it'll be extremely painful. It's not good. She said the pain is not worth it. She had a breast reduction, and she said she did roll over, and the pain was so bad. And she said she doesn't recommend that you do that. So she says use any way that you can to make sure that you don't roll over. She does recommend that you sleep sitting upright. So if you can get a chair to just sit in it and kind of like sleep in that until you've healed better, she said that is a plus. So I'll be bringing in my recliner that we have in our house and putting in my room. I also will be using the pillows in case I do want to lay in my bed. I will be home for 2 weeks, so just being able to have the versatility of either being in the chair or my bed, that's why I bought the body pillow. And I do have a bunch of other pillows I will be stacking around me as well to keep me elevated so that I do not roll. She also recommended in the pamphlet that they give you is that you have very loose fitting clothing the day of surgery. The reason being is because you will have no mobility of your arms. You won't be able to raise them above your head. You won't be able to like spread them out. So the bigger and looser your clothes, and especially if they can button or zip up in the front, it's so much better and easier for you to get into, because you won't be able to have that mobility to put something on over your head or anything like that. So the bigger, baggier, and loose fitting it is, and it has a zip or buttons in the front, is better. So definitely make sure you can grab a few shirts. If you don't want to buy anything too expensive, I went to Value Village and Tali's or Talise, whatever it's called, and I bought a bunch of shirts there. I ended up getting like 5 or 6 baggy shirts. Some even had zips in the front. And that cost me like $20. I know I'll never wear them again, and it's just like perfect. So that's also what I did. And then after you've read out the tips, those are the tips on the pamphlet. Also, another tip is you have to bathe with antibacterial soap that has no scent. And make sure you have on no nail polish on your fingernails or your toenails. You have to be polish free. And that was basically it. Oh, you can't drink past 12, and you can't eat anything after 12 the night before surgery. And when you do shower with the antibacterial soap, you cannot put any moisturizers or lotion on you. You have to just come the way you are, ashy as hell, and go into surgery. So that's something they told me as well. And then one of the other things I was talking about before is scheduling your pre-op appointment with your physician. So I had that appointment today. Basically, they will give you a piece of paper that your physician has to fill out and basically just sign and say that all of these things are true and correct. And then they have to ask you those questions, which are like, do you have kidney failure? Have you had surgery before? Stuff like that, and just fill out the paper. They will sign it and stamp it, and they will send a copy off to your doctor, to your cosmetic doctor, and then also a copy to the hospital. I mean, they'll give you back a copy that you'll have to take to the hospital the day that you go in to surgery. Now, another thing that that will also happen is you will have to speak to the hospital, like I was saying, where you're doing your surgery at. They're going to call you and basically ask you the exact same questions your physician just asked you. So they're going to ask you those same questions over the phone. Based on your answers, they will let you know if they want you to come in to do blood work or if you don't have to come in to do blood work. I didn't have to. So I literally have no interaction with the hospital or with my cosmetic surgeon until 2 days before the surgery. They both will call you just to confirm that your appointment date is coming and that what time you have to be at the hospital. And that's really it. I really don't think there's anything else that I need to tell you guys. The process was super simple. Way more simple than I saw in some other videos. A lot of girls in the States and the UK had to go through a lot to get their surgery, but I really didn't have to. It was literally just a waiting game, and if you want a breast reduction in Canada, and depending on how busy your surgeon is, I think the sooner the better. Start the process as soon as possible because it's not going to happen instantaneously. You will have to wait to get your appointment and get approval from OHIP, and just start the process as soon as possible. Also, be aware of the cosmetic fee. I wasn't aware of the cosmetic fee. $2,500 is a lot of money. Not a lot of people have $2,500 just to drop like that. So the waiting period is good and not good because it enables you to save up that money. But definitely just keep that in mind, and yeah, start the process as soon as possible. If I had known, I would have started it a lot sooner. I always thought it would have been a hassle, but approval came really quickly, and I can't be more excited. So my surgery is coming up on the 25th. I'm so excited. I cannot wait. Hopefully, I'll be able to vlog the day of surgery. I've never vlogged before. I already know it's harder than it looks, so I highly doubt I'll be able to vlog because I'll be in so much pain. But I will try my best to vlog for you guys. And then if I don't vlog, I will be doing a 1-week update and for sure a 2-week update. I don't know if I'll do any more updates after that unless I reach like 6 months or a year, because nothing really changes. The doctor told me that I won't know my true breast size until like a year after my surgery, and basically I don't know if I'll have anything else to give to you after like 3 weeks have passed, because I don't think anything will change. But I could be wrong, and I may have missed anything you guys wanted to know in this video. So leave any comments below. I will do my best to answer the questions that you have, and if I don't know the answers, I'll ask my surgeon after one of my follow-up appointments. Hopefully this helps someone out there who's thinking about getting a breast reduction. My thing is, do it as soon as possible. If you want it, get it done. I saw so many other people getting it done and I was so scared, but now that this is happening to me, I'm so excited and like I can't contain it. I talk about it all the time. So I hope this video helps you. If you have any questions, let me know. Thank you for watching. Bye.